Hi, I'm Dr. Ritika Goyal and I'm a pediatric chest and allergy specialist in New Delhi. Today we're going to discuss about a special allergy test called the skin prick test. First of all, let's know about allergy testing. So allergy tests हम करते हैं ये जानने के लिए कि हमें किस चीज़ से एलर्जी हो सकती है. There are certain things that are very commonly known to cause allergy. It can be a food item, it can be airborne. But usually respiratory allergies airborne allergen से ही होती है. अगर हमें जानना है कि हमें किस चीज़ से एलर्जी है तो हम ये एलर्जी टेस्ट करवा सकते हैं. Skin prick test is a special type of allergy test which can be done in children as young as 3 to 4-year-olds. So when do you need a skin prick test? Your allergy specialist or your physician might suggest you a skin prick test if your child is suffering from the following conditions, like if he has respiratory allergies like allergic rhinitis or asthma, where the child is sneezing a lot, or he has a constant nose block, repeated colds, chronic cough, which gets relieved with inhalers or levolin nebulizations, that kind of a condition. Then skin allergies like atopic dermatitis or eczema, child with acute urticarias, child with any food allergies like he eats a food item, gets hives, gets swelling, or he has itching, swelling of the lips, which is also, these symptoms are known as angioedema, or he mounts a severe allergic reaction to anything, a food item or any airborne thing, a bee sting, called anaphylaxis. In these situations, we can get a skin prick test done. So how do we do the skin prick test? We have liquid extracts of different allergens available to us. These allergens can be any pollen, any grass, weed that is in our surrounding, insects, animal danders, like if you have a pet, then we have animal danders like dog, cat, cows, buffaloes, horse. Then fungi which grow on molds, sealant जो लगती है उसमें fungi आते हैं, that we can test for. So these allergen extracts are available to us. We take a small drop of that allergen and put it on the hand, on the arm of the child. Then we take a very blunt needle, a lancet, and we do a very small prick on that allergen and try to put it under the most superficial layer of the skin. I know it sounds scary, but it is not, and it is not painful. A lot of kids get it done and they're very comfortable in the test. It's not really a prick but just a scratch to put the allergen in the superficial layer of the skin. And then 15 minutes later we read the test, and if the person is sensitized to that allergen, there is a swelling in that area. We measure the size of the swelling and find out whether that test is positive or negative. We also put a positive and a negative control. That means we need to check whether the test that we've done is valid or not. So we put a saline and a histamine bleb also, and we prick it, and we should get a positive result on histamine. That is how the test is done. Skin prick test helps us in identifying the allergen. We have to corroborate a positive test with the history. Sometimes we get some food items that are positive on skin prick test, but the child has never been exposed to those food items. That just means that he is sensitized to it. It may not be causing the symptoms. So that's where we chip in. That's the role of an allergy specialist, because we take your history, we look at your symptoms, we check your results, and then we combine the thing and tell you what you're allergic to. How should you prepare for a skin allergy test? If you're going for a skin allergy test, then you should know that it's a 15-20 minute procedure. It is not very painful. Your results will be there in front of you there and then. Your physician will advise you that you don't take any oral medication, especially anti-allergy medications like Allegra, cetirizine, levocetirizine, Atrax, Maxtra. These kind of medications should not be taken at least a week prior to the test. Your inhalers and nasal sprays can be taken, but try to avoid them on the day of the test. One more thing is, in children with severe skin allergies, atopic dermatitis or eczema, the arm should be free of skin lesions. We can't do the test if you have active lesions on the arm. And make sure your child is wearing comfortable clothing, not too tight clothes, and we'll be doing the test on the arm, so he should be able to roll the sleeves comfortably. There is a theoretical risk of an allergic reaction, but honestly, it is only theoretical. In practical life, we don't see any complications because the allergens are so diluted that they can't mount a very severe reaction. So it is practically 99.9% safe. Little bit of pain children might feel because it feels like an ant bite sometimes, but other than that, no side effects, and it is absolutely safe. How does the skin prick test help? Once we identify the allergen that is causing all the symptoms, we can employ strict allergen avoidance methods. If we are able to avoid the allergen completely from the environment, 90% of the job is done. But more often than not, these aeroallergens cannot be avoided because they are present everywhere in our environment. If your child is allergic to some pollen which is seasonal, suppose it comes only in winters and not throughout the year, then we can increase the pharmacotherapy, the doses of the medicines that your child is taking during that season, and then we can cut down on the doses when the season is gone, just to keep your child symptom free. Another benefit is, if we know the allergen that you're allergic to, and if we feel that the immunotherapy is very effective, then we can advise allergen immunotherapy in these cases, which really works in severe allergies.